Now, our patient, if you look back in our patient history, there was a history of fall about 3 months back. Whenever you have a fall in 3 months back, you need to look at was there any some sort of a fracture or not, was there any associated pathology as well or not. Because usually the patient, although if the patient has an old age, usually they have a trivial falls leading to head and neck femur fracture. This will also lead to eventually osteoarthritis as well. And sometimes what happens is that the patient may be young but may have a high a great motor vehicle accident in which patient was at a high speed accident leading to acetabular and pelvic fractures. Although they may require fixation or they may not require fixation, but eventually if some form of fixation was done, anatomic reduction was done at the time of surgery or not. Because if the anatomic reduction is not done despite fixation, eventually this will prelude to osteoarthritis. In our patient, she had a trivial fall history with no fracture, but actually that was sort of a contributing factor to underlying pathology of degeneration, and it actually resulted in accelerated injury leading to she developed pain and osteoarthritis later on after a few months as well. Now, when you're looking at post-traumatic hip osteoarthritis, what you need to look at whenever we get an X-ray pelvis view, AP view of the joint, you have to rule out whether there's no associated femoral head or neck fracture. Was there any intertrochanteric fracture present at the time of injury, or was there any fixation on implant, metallic implant is there or not? Was there any associated pelvic ring fracture leading to disruption of the pelvic ring or sacroiliac joint, or there was any problem with the acetabulum or not? Because if there is acetabular or sacroiliac joint involvement or pelvic ring involvement, this will develop some form of osteoarthritis, which will eventually lead to post-traumatic osteoarthritis and would require some form of a joint replacement later on. Because once the anatomy is altered, the biomechanics at the hip joints are altered, and this will lead to increase forces at certain joints as compared to other, eventually leading to increased degeneration of the hip joint.